As the province braces for a fall surge in COVID-19 cases and flu season, the health minister revealed her plan to support the struggling healthcare system while evading COVID restrictions. However, critics say the plan blurs the line between public and private healthcare. We get that story from Phil Perkins.
During the height of the pandemic, scheduled surgeries and procedures were either canceled or pushed back. Today, Health Minister Sylvia Jones says some of those will be performed in private health centers paid for by OHIP.
The value of having some of those independent health facilities that have existed in the province of Ontario for literally decades to take some of the pressure off of our healthcare partners.
Minister Jones didn't detail what kind of surgeries or procedures would be moved. The opposition NDP were quick to point out two things. First, more public-private integrations are coming, and secondly, be prepared to pay for some services.
What's happened is we've had public health care that's been starved for funds, that's been treated with disrespect, that's in a crisis, and it's set things up for privatization. I think that's where he's headed.
All but one are all for-profit. The Kingston Health Institute is not for-profit. The rest of them are all for-profit, and every single one of them charge fees for things that are not covered by OHIP. You want to go to have your cataract surgery done, you can have the same surgeon, the same patients, the same surgery done in a hospital, everything will be covered. The minute you are in an independent health facility, the ophthalmologists prefer to use that lens. That lens is not covered by OHIP, therefore it's going to cost you $400.
Private healthcare hospitals is already happening, with agency nurses filling in for staff nurses that have either retired early, quit, are sick, or joined an agency themselves, often earning double their normal salary. Jones understands there's a problem, but at the same time, doesn't express concern over the use of private nurses.
They have been in existence, and they are part of our hospital continuum and our healthcare continuum. We are seeing more and increased use of agency nursing, and we want to have those conversations to make sure that, frankly, we don't do something that unduly impacts another part of the healthcare system.
She points out that the Ford government has worked with the College of Nurses of Ontario to license 600 internationally trained nurses since January. They aim to add another 400 soon. Additionally, the province is temporarily paying the $1,500 that covers exams, applications, and registration fees. However, the CEO of the Registered Nurses Association of Ontario says unless the wage capping Bill 124 is repealed, all of this will be for naught.
If we don't do away with Bill 124, these nurses will come, and many of them will go somewhere else. We will become the bridge for them to go somewhere else. So it will be all for nothing, and Bill 124 was not mentioned today. It must go. It's the biggest retention barrier, We have nurses going everywhere, and the minister is well aware.